Medicaid, which more than 1 million Minnesotans rely on for their health care coverage. It's worth dwelling on that, I think. We had a great conversation before we gathered, and we heard about the critical and life-saving care that the hospital provides, care that is only possible because of Medicaid. I'm here not only as a congresswoman representing the 3rd district in Minnesota, and I represent tens of thousands of Minnesotans in my district who get their health care coverage from Medicaid, but also as a physician who's had the honor of taking care of Minnesotans for more than 20 years. And as an obstetrician, I know how important Medicaid is to pregnant women, new moms, and their babies and families. More than 40% of births in the United States are covered by Medicaid. We've heard the statistics and the personal stories this morning, and the facts really could not be more clear. This hospital provides critical healthcare services in our community, and it cannot continue to do so without Medicaid. You know, this is the 6th local hospital or clinic that I've visited and spoken with in just the last couple of weeks, all of whom are terrified what these proposed cuts to Medicaid would mean for their patients and communities. Not only would it mean services and coverage being cut for individuals, it would mean entire hospitals being shut down. And as Representative Omar and others said, it's obviously devastating for people who get their care through Medicaid, but it's also bad for all Minnesotans, whether they get their health care through Medicaid or not. And also, let's just level set why this is happening, why we're even having this conversation. The whole reason we are is because the Trump-Vance administration and their unelected, unaccountable benefactor advisor Elon Musk are looking for ways to make the math work so that they can get tax cuts for billionaires. It's really that simple. They're putting healthcare for pregnant women, children, low-income people, elders in nursing homes, and children living with disabilities on the chopping block so they can cut taxes for the wealthiest among us. We don't have to be doing this. I am so grateful to the doctors and patients and hospitals who are using their voices and their stories and their experience to ring the alarm bell and advocate for their very survival. But it should not be this way. We should not have to be pleading to keep our local hospitals open to pay for tax cuts for billionaires. And this shouldn't be a partisan issue. Healthcare is not a partisan issue. We all need it. No matter where you live, who you vote for, everybody needs access to healthcare and open, functioning hospitals. So whether you get your care through Medicaid or not, you should be concerned because this impacts all of us. I was so heartened to see that more than a dozen Republican Minnesota state legislators sent a letter imploring congressional Republicans and President Trump to not go through with these proposed cuts because they know these cuts will be devastating for our state. Just listen to what they had to say. Quote, drastic reductions to Medicaid funding have the potential to impact the 1.4 million people we serve and place incredible pressure on our overall state budget, end quote. This is not a Democratic or Republican issue. This is an everyone issue. It's a Minnesota issue. It's an American issue. At least some Republicans in the Minnesota legislature understand what the impact would be. We need Republicans in Congress who have the majority and control the agenda to stand with the people of Minnesota, to stand with the American people, to put people's health care over tax cuts for billionaires. And we only need 3 Republicans in Congress to stand up to President Trump and Elon Musk and say no to cuts to Medicaid. These are challenging and frankly very scary times. But I want everyone here to know that we are not powerless. What Hennepin Health, what doctors and patients and county leaders are doing here today is critically important. Speaking out and sharing stories is one of the most powerful tools that we have right now. And public pressure works. Just last week, after thousands of Americans joined in dozens of cities all across the country at Stand Up for Science rallies, including here in Minnesota, the Trump White House withdrew their anti-science, anti-vaccine nominee for CDC director because they didn't have the votes to get him through the Senate. That was a win for public health, and it happened because Americans elevated the issue and said, this will not stand. So we have to continue to speak out and push back and fight every day to say that these are dangerous, that we reject them, and that we will fight every day to protect Minnesotans' access to care. I thank everyone here for your tireless work and advocacy to protect Minnesotans' access to care. We stand with you in this fight. Thank you so much.